Yeah, so OR nursing, it's very different from the floor. You're going to be interacting a lot more with your scrub techs and your anesthesia providers and your surgeons more than your patients. All of your patients are going to be asleep, so you'll have very minimal interaction with them in pre-op, and then after that, they'll be asleep for the entirety of the case. As an OR nurse, it is your job to set up the room and make sure that you've got everything that you need for the case. You're going to count like your instruments and your sponges, things like that, pull any meds that you need, and then you're going to bring your patient into the room. You're going to help anesthesia put them to sleep. You're going to position, you're going to prep, you're going to tie up the back of the gowns of your surgeons and your scrub techs, and then during the case you're going to chart, and you're also going to be kind of a runner for any supplies that they might need. You're also a big communicator with between the surgeon and the family and PACU and everybody else. Once the surgery is done, you're going to take your patient to PACU, give report, and then you're going to go back and do it all over again multiple times a day. As far as tips and tricks, I would say have a thick skin. You're going to get a lot of heat from the surgeons, especially whenever things are going wrong or it's a very stressful case. Unfortunately, you're just the first person in their line of sight, and they're going to take out all their anger and frustration on you. It's not necessarily a reflection of you, it's just part of the job. There's also some big attitudes and egos you get to deal with surgeons and even first assists and scrub techs and other nurses sometimes. And at the end of the day, we're all a team, so you got to be able to work together even if you don't necessarily mesh together all that well. And also, as an OR nurse, you kind of have to be self-sufficient, I guess, in a way that, like, sometimes the equipment isn't going to work or things are going to go wrong, and you need to be able to figure it out, whether or not there's a rep or like an IT number to call. Sometimes you just have to be the IT person yourself and figure out what's wrong and try and fix it, whether it's like the handpiece or the generator or things like that. But the perks of working in the OR is you're only ever going to have one patient at a time. You don't have to worry about having unsafe ratios because you can only have one patient at a time. And I think it's a very enjoyable job.